Hello dear friends, today we are going to learn about jaundice. After watching this video, you will be able to describe the etiology and pathogenesis of jaundice. You will be able to name the sign and symptoms of the disease. You will be able to mention the complications of the disease, and finally you can suggest diagnosis and treatment. Now let's take a look towards jaundice. Jaundice is also known as icterus. Jaundice is nothing but it is yellowish or greenish pigmentation of the skin, sclera, and mucous membrane due to hyperbilirubinemia and deposition of bile pigments under the skin. This is mostly associated with itchiness. Also, the patient he experiences pale feces and dark urine. In babies, it is very common, and if this bilirubin is not lowered in case of newborn baby, then it might lead to kernicterus. The causes can be non-serious to fatal. The level of bilirubin in the blood is normally below 1 milligram per dl, but when the level is above or in between 2 to 3 milligram per dl, it results into jaundice. There is equilibrium between bilirubin production and clearance, and if this balance is disturbed, it results into jaundice. Jaundice itself is not a disease, but rather it is a sign that can occur in many different types of diseases. Now let's take a look towards its risk factors. Jaundice can occur due to acute liver inflammation, due to bile duct inflammation or obstruction, due to hemolytic anemia, or it can occur due to cholestasis. What are the symptoms of jaundice? Firstly, there is yellow discoloration of the skin, mucous membrane, and whites of the eyes. There is occurrence of light colored feces and dark colored urine. There is itchiness all over the body. There is extensive abdominal pain, nausea and vomiting. There is fever, fatigue and weight loss. Also there is headache and confusion. Now let's take a look towards bilirubin metabolism. The bilirubin is a yellowish pigment and it is found in the bile. Now bilirubin is a breakdown product of hemoglobin. Whenever your RBC's lifespan of 90 to 120 days is over, the RBC undergoes senescence, that is apoptosis. This RBC is broken down into its two components. The one is globin and the second one is heme part. This heme part, it is converted to biliveridin by the action of biliveridin reductase. It gets converted to bilirubin. Now this formed bilirubin is unconjugated form and it is going to move inside your liver. Inside the liver, it gets conjugated with glucuronic acid and this conjugated bilirubin then moves inside the intestine. Inside the intestine, the bacterial flora, it is going to cause oxidation and metabolism of this bilirubin, converting it into urobilinogen. Now, 1% of this urobilinogen is reabsorbed into the enterohepatic circulation for excretion through the bile, and some part, remaining part of this urobilinogen is converted to urobilin, and this urobilin, uh, and secondly, it forms stercobilin. Now, this urobilin is responsible for giving urine its yellow color, and this stercobilin gives feces its typical brown color. Now, what are the causes of jaundice? The first is excessive production of bilirubin, then as compared to its excretion, then defect in the liver that helps to remove bilirubin from blood, either by conversion to conjugated bilirubin or by excretion via bile. Thirdly, it can occur due to blockage of the bile ducts that decrease flow of bile and bilirubin from liver to intestine. And lastly, it can occur due to blockage uh, due to gallstone, cancer, inflammation of the bile duct, etc. The diagnosis is basically dependent on physical examination. Also, you can go for blood testing. You can detect the level of bilirubin. If a high level of unconjugated bilirubin is there in the blood as compared to the conjugated bilirubin, it suggests jaundice. Thirdly, you can go for CBC, that is complete blood count. This measures the levels of RBC, WBCs, and platelets. It also determines your cholesterol level. You can also go for testing for hepatitis A, B, and C. This test for a range of liver infections. And lastly, you can go for sonography, CT scan, liver biopsy, endoscopic retrograde, coloangio, pancreatography, that is ERCP, etc. The treatment includes, the first is you have to treat the underlying condition, then you have to make the person rest at home, you have to give him IV fluids, medications, antibiotics, blood transfusion. You have to discontinue the drug or the toxin which is responsible for this jaundice. And in case of newborn babies, exposure to special colored light, that is phototherapy, or blood transfusion is done. And lastly, you can go for surgical treatment in case of obstruction. So this was all about jaundice. Thank you for watching.